Hello, my name is Deborah Medina. This is my discussion board for my nursing philosophy. So the philosophies I chose, the three of them, are holistic care, ethics, and culture sensitivity. With holistic care, I strive to address a person's physical, emotional, and spiritual needs in order to treat them as a whole person. Ethics, it's crucial for any nurse to uphold ethical standards, integrity, honesty, and confidentiality. There is also cultural sensitivity. I adjust my care to fit each patient's unique needs and respect their cultural backgrounds. These three ideas have grown out of my experience, my conversation with patients that I've had, and ongoing self-awareness. As I look back and reflect on these, they influence my nursing philosophy and serve as a roadmap for developing comprehensive patient care. In order to provide individualized and considerate care, I try to comprehend these and include them in my care plans and the care that I give to my patients, especially with their families as well, and when collaborating with the healthcare team. These guidelines also support the delivery of nursing care that is secure, efficient, and compassionate. So holistic care, this is one that I love and have near to my heart. It's treating a patient as a whole and taking into account every aspect of their well-being. That is known as holistic care. I evaluate not just their physical symptoms, but also their emotional and spiritual needs. Working in the ICU, we're drilled to find the root cause of what's going on and stabilize the patient. As long as they're, hemodynamically stable, that's what we strive for. But then also I have to sit back and remind myself, okay, this person is going through one of the worst days in their life. Maybe they don't have family at bedside. Maybe they do. Maybe they have other stuff going on. They're pretty worried. There's a lot that a patient experiences while being in the hospital bed. And so to offer that compassionate care goes a very long ways. And just to be empathetic, putting ourselves in their shoes. Not much is known about a patient until, of course, we start reading through their notes, going through their background, and then we start to be more empathetic. But regardless whether we go through their notes or not, whether we know the patient and the patient's background story or not, we should still offer holistic care. Holistic care acknowledges the connection between an individual's physical, mental, and emotional, as well as spiritual health, in addition to treating the patient's physical symptoms. As a nurse, I try to provide holistic care by taking into account the patient's emotional needs, social support system, such as their family, their friends that come visit, other people on the healthcare team, especially chaplain, or if they don't have such spiritual beliefs, just being there for them, offering them support. This method of holistic care promotes general wellness and healing by enabling a more thorough and customized care of experience. So ethics is also a very major nursing philosophy. So in order to uphold trust and professional standards, I keep my patients' information confidential. I show them and myself integrity, as well as with my coworkers. Be truthful, and then these are all critical aspects of nursing ethics. I really want to dive deeper into the truthful information. So as a nurse in the ICU, we get a lot of questions from family. It's a lot that's happening at one time that they may not be able to wrap their whole head around just yet. And so my coworkers that I work with, the team that I have, they're great. The residents, physicians, doctors, they do a phenomenal job at talking to the family, at talking to the patient and letting them know and giving them truthful information. It is hard for me as a nurse in the ICU because if a patient's prognosis is not good, I could do so much in telling the family and hinting them unless they directly tell me a question. But for the most part, I always let them know how they're doing, just giving them updates over the night, and let the providers handle the more serious talks. But I will always give truthful information to my patients and their family. With that, I love to educate my patients and let them know what's going on, because there's a lot of the times where, I see whenever I help out my colleagues or whenever I'm starting something, and if my patient's alert and oriented, I love to tell them about their medications, about why they're getting it, because that also serves as a chance for me to educate myself as well. And doing that, I love to do that to educate my patients, because I'm learning in the meantime too. Some of my patients, they'll tell me, oh, well, I wasn't aware of that. I didn't know that that was used for that. And so I think that's a great way of doing that, of providing that truthful information through education. In nursing, ethics are essential to upholding integrity, trust, and patient advocacy, upholding such morals and principles like preserving patient privacy, fostering beneficence and non-malfeasance, and honoring patient autonomy are all important to nurses. By following these guidelines, nurses can make sure that decisions are made cooperatively and patients' rights are upheld and care is given morally and safely. Then lastly, there is culture sensitivity. So this is understanding and honoring the patient's cultural values and beliefs. With this, it's to be sensitive to cultural differences. It entails acknowledging and appreciating the patient's cultural background, views, values, and customs. As nurses who are sensitive to cultural differences, they can offer patients care that is inclusive, respectful, and customized to meet their specific needs. This includes addressing cultural barriers that might affect their experience in the healthcare setting, as well as comprehending cultural norms, preferences, and communication style. This is one that I like to see. I've come from a rural area, and so now going to an urban area where I see more cultures, it has really opened my eyes into providing and to being culturally competent and culturally sensitive with my patients. And I also love learning about people's culture. Just recently, I had a patient from Lebanon, and they were telling me everything about that. They were telling me about their foods, and I loved hearing that. And just knowing everything about a patient's culture, being open-minded about it is great. I love it. I aspire to learn more about cultures. I love to travel and get to know people. So this is also one of the nursing philosophies that I hold near and dear to my heart. So examples of each, I wanted to provide that. So holistic care. Suppose I'm looking after a patient who just got out of surgery. I'm going to go evaluate their emotional health, and then of course their physical health, see if they need pain medications, keep an eye on their vital signs, and speak with them in a therapeutic manner to provide support and reassurance to attend their physical and emotional needs. That's what holistic care is about. In ethics, an example of that would be to maintain strict confidentiality. Let's see. And then whether that be during conversations with the rest of my colleagues and with family. Something that we do in the ICU is we set up passwords with our family members, and we tell the patient and the family whether they would like a password, because a lot of families starts to calls just flood in throughout the day and throughout the night. And so to provide one patient or one family member with the password and let them share it with whoever the patient would like to know about their hospital stay, we give that password to them. So whenever they call and they give us the password, whether it be anyone, a friend, a family member, we could go ahead and give them that information if they have that password. Culture sensitivity. So assume that I have a patient from a different culture. I'm going to ensure that there is effective communication between us, that they understand what is going on, and honoring their requests and respecting their cultural values in the healthcare environment, and acknowledging and being open to the differences and respecting them, of course. So principles, holistic care, because it supports my view that healthcare is multifaceted. It is essential. It's important to nurture the mind and spirit in addition to healing the physical body. I'm able to give care that is genuinely customized to meet the needs of each patient. by taking into account all facets of their well-being. It brings me satisfaction to witness my patients find comfort and resilience in a deeper level in addition to their physical healing. So I really love that with the physical and the mind. Like a healthy mind can create a healthy body by taking such actions. Then ethics, it's the foundation of nursing. It gives directions on how to behave honorably and speak up, advocating for patients, moral principles. It guarantees that even in challenging situations, act morally. Then there is culture sensitivity, which respects and values diversity. And then to apply that to the medical environment. And then being sensitive to the diverse community, establishing a connection with the people, and being mindful of their cultural identity. So in conclusion, together, these principles create a compassionate, moral, and considerate nursing practice that honors the diversity of humankind. These are pledges to respect the humanity in each and every aspect I care about. These ideas are critical to nursing practice because they support patient-centered approach, build rapport and trust between the nurse and the patient, and enhances healthcare outcomes. Nurses can offer people from all walks of life compassionate, secure, and efficient care by embracing holistic care, ethics, and cultural sensitivity. I can better appreciate the significance of each principle to my own nursing philosophy when I devote time to reflect such philosophies. This is something that I had created, a little diagram that I really love spending time on this and making. So I have the physical in purple, the emotional in orange, and then, the spiritual in orange, and then emotional is the heart, that's in red there. And then ethics, since ethics is the backbone of nursing, I created that as a backbone. And for cultural sensitivity, I put the different languages of saying hi. So the three guiding concepts of my nursing philosophy, which are the holistic care, ethics, and culture sensitivity, are represented in this diagram that are interconnected. The patient's mental, emotional, and spiritual health are all included in holistic care. My actions are guided by ethics to maintain patient advocacy and honesty, culture sensitivity by encouraging inclusive care and respect for people from different backgrounds. So altogether, these ideas provide a compassionate and respectful approach to nursing. And then here are my references that I used. They are from the class that helped inspire my nursing philosophy and helped me think about the three that I chose. Thank you for watching.